outbreaks are devastating from a sociological perspective. We're afraid as people, and we have the potential to lose loved ones, and some of us do. And we always ask ourselves, could this have been avoided in one way or another? But having worked through a number of larger public health crises in our country, the Lyphocytomene crisis, the listeria outbreak, I've learned that every outbreak leaves a legacy behind it that allows us to harness the good or the gift that there was in that outbreak in terms of the way we organise ourselves as people and the way we look after and care for ourselves. So if one looks at the Lyphocytomene crisis, the emphasis on mental health care users, the human rights, the conditions in which they live, the legal framework in which mental health care users are cared for, all became stronger. Public awareness about the plight of mental health care users became such that it's no longer possible for those unfortunate events to unfold again. And if we look at the listeria outbreak, the legacy that was left there was around food safety. At a legislative level, the food safety laws have been revised. Companies are a lot more attentive to adherence to food safety because of the disastrous economic implications for them, not to mention the loss of human lives. But also the public heard, many of us for the first time, about 5 keys to safer food. And we learnt about hand washing before and after preparing food. We learnt about how to reheat food so that it doesn't cause, so that if there are any bacteria in it could be killed. And the benefits of that terrible event, the lessons we learned, are available to us for many generations to come. The children who couldn't eat polony will never forget the time that there was an outbreak of polony and remember the lessons that were learned as a result of that. Outbreaks have been sweeping through humankind for millennia, right from the plague through to last year's listeria outbreak. And each time these happen, there are benefits and things that we can learn to make ourselves as a society stronger. At a small level, the lessons that we are learning in these outbreaks, like the way we interact with our friends and colleagues, and in terms of ordinary respiratory hygiene, cough etiquette, how to cough respectfully, how to keep a safe distance so as not to allow our droplets to infect anyone, are going to stand us in good stead, not only for coronavirus, but for influenza, which sweeps across our country every year, and which causes deaths which we all take for granted because, it's influenza. But yet the interventions that we're learning now will save lives going forward. One of the things that I reflect on is that coronavirus is here to stay. This particular coronavirus is not going to go away, and it's going to change the way we interact as people in a way that can only leave us stronger. Many of us will have noticed, and I'm stepping out of the realms of the scientist now, but many of us will have been aware of community initiatives to look after the more vulnerable in our society, and these are really the opportunity for us to reflect more critically on how we live and what our values are. Many of the people who are affected by coronavirus or at greatest risk of death are the elderly, and yet the elderly play such an important role in our society. They often look after grandchildren. They often contextualize the struggles that we're going through as young people by providing some context and by giving us the perspective that things pass and that we recover. And without them, we're poorer. And the emphasis that we're learning on valuing the elderly is something that really will stand us in good stead forever. I'm not a royalist, but I listened to the Queen's speech, Queen Elizabeth's speech, and what struck me most about what she had to say was that she felt very similar to the time when she was a young girl in the 1940s, and Western Europe was in a crisis because of Hitler's political onslaughts into France and Austria, and she spoke a message of encouragement to her, to the listeners in Britain, and here she is, 90 plus, encouraging us that, you know, coronavirus will not always have the same devastating consequences as it is having now, and it will pass and we will recover. And you know, that's the gift of perspective and context that the elderly can offer us. And so there are many lessons to learn. Of course, the science of outbreak investigation and management and preparedness will forever be strengthened. Our generation will never forget, from a scientific perspective, the need to retain the lessons that we've learned in organising ourselves and in responding to outbreaks. So, you know, ever since I developed an interest in infectious diseases in the early 90s, when I was at medical school, we were always taught about the next influenza pandemic, and it was spoken of with great fear and terror, because perhaps we'll have another influenza outbreak like the 1918 flu pandemic. And we all kind of didn't take it very seriously. We knew it would happen one day, but we didn't really gird our loins, so to speak, and put the necessary structures in place to help us prepare and plan. And over the last few years that I've been in outbreak investigation and management, it's always been incredibly difficult to mobilize the various sections of the health departments across the country to work towards preparing and developing the structures such as outbreak response teams and appropriate screening and prevention measures, because the impact of an outbreak was never really been at the top of our consciousness. We haven't lived through an outbreak of this magnitude in living memory, and so it was very difficult to get the support of health systems. Us as healthcare workers now who've been involved in this outbreak will never ever take outbreaks or the threat of outbreaks lightly again. And with the experience that we've gathered in terms of how to organise ourselves, how to think through what the preparedness and response activities could be, on how to communicate with the public around what interventions need to be implemented, how to plan for laboratory diagnostics, how to plan for extra bed capacity, how to engage across different sectors, emergency medical services, port health. We'll never have this problem again, our generation. We'll all know absolutely innately how critical each member of the multidisciplinary outbreak response team is. We'll never take each other for granted again and our particular roles. So there's lots to learn, and lots that we can be grateful for to keep our children and the next generation safe. So in that regard, as frightening as it is, there are always good things that we can take and carry forward with us on our journey to ensure health for all.